Welcome, welcome friends. Welcome to this very significant webinar where we are going to be introduced to some very important documents and tools. And most importantly, this is the World AIDS Day, and we are so happy that you can come together. I would like to welcome each of you warmly. I would like to welcome you as faith communities or from different parts of the world, part of our wider faith the constituency. HIV ministries, people working on the ground, people working in policies, churches. We would like to welcome also the UNAIDS officials, our partners, also WCC leadership and commission members. I would like to just give a few thoughts and a short prayer as we to begin this discussion. I would like to read 2 verses from the Bible and then elaborate for a couple of minutes on this. I read from Romans chapter 1, verse 18. For the wrath of God is revealed from heaven against all ungodliness and wickedness of those who by their wickedness suppress the truth. During this World AIDS Day and with all these tools, we want to lift up the truth about the situation regarding HIV. The truth is very important. We are mandated to work against untruth. We are mandated to work closely with the latest science, with the latest evidence, and with civil society to overcome ignorance, overcome stigma, and overcome fear. So when you actually look at the word truth in Hebrew, the word is emet. And it is spelled with 3 alphabets. Aleph, Mem, and Tav. Aleph is the first alphabet, Mem is the middle alphabet, and Tav is the last alphabet of the word truth, emet. But in the whole alphabets, of all the alphabets of 23 alphabets of Hebrew, Aleph is the first of the 23. Tav is the last of the 23, and Mem is somewhere in the middle. It's the 13th. So you can imagine the word truth itself encompasses, embodies everything from the very beginning to the end. And in fact, if you remove one alphabet, it would mean death. So truth and overcoming ignorance, and the truth to be promoted with strategies of dealing with HIV in the latest of our knowledge is central. The second verse I would like to read is from Ecclesiastes chapter 10, verse 10. If the iron is blunt, in other versions it would also say the axe. If the iron or the axe is blunt and one does not whet the edge, whet means also sharpen. If one does not sharpen the edge, then more strength must be exerted. But wisdom helps one to succeed. Skill is so important. Methodology and how to do good practice is essential for us to be efficient and to do the work that we need to do. These are biblical truths, scriptural truths, and of course it goes even beyond our own faith. In all faiths, this is the general trend and general revelation. So let us say a word of prayer. Loving Lord, as we go through this time, guide us. We are going to hear some very, very important truths, strategies, and methodologies driven towards overcoming HIV. And these have been gathered from a tremendous wealth of knowledge of good practices from your children from different regions of the world. We pray that you guide the resource persons. We thank you for the wonderful work that they have been able to do to garner these truths and then put it together in the form of a document. Help them to share this and help them to explain this and give us the wisdom to understand and to apply it in our life. We especially pray that you strengthen us during this World AIDS Day, which has the theme of let communities lead, that we give space and safe spaces for the communities most affected and let them participate and lead the way to overcome the HIV. Bless this time through Jesus Christ our Lord. Amen.
Amen. Thank you so much, Dr. Manoj Kurian. Good afternoon, good morning from wherever you are joining. My name is Gracia Violeta Ros. I am Program Executive for the HIV and Other Pandemics program in the World Council of Churches. I am a social anthropologist by training, and I am also an activist, an advocate living with HIV since 23 years ago. And I'm going to moderate the webinar and tell you about the objectives. This webinar was prepared so that we can present 2 new tools that the World Council of Churches has developed in the last 3 months for faith communities. The purpose of these documents have the idea of strengthening the response by the HIV sector, but the faith sector doing HIV work. I will not present the documents because that will be done by the author, who is Dr. David Barstow. But before that, we are going to hear from Jacek Zaiko from UNAIDS. I'm sorry if I didn't pronounce well your last name. Jacek is a tremendous ally for the HIV response. We work with UNAIDS a lot, and UNAIDS has demonstrated total commitment to the faith sector in the HIV response. So he will give us some ideas of why we need 2 HIV documents. Aren't there many already? So why is the need of these documents? Jacek will address us in that sense. Go ahead, Jacek.
Thank you very much, Violeta. Thank you very much, Manoj, for the prayer. Actually, I should start with an observation that probably never before in my active participation in any of the webinars or conferences, the prayer was not so well reflecting like my own remarks around the issues that we are going to discuss today. And I highly appreciate it, because mainly like it is about tools. But what are tools? Tools are the stuff that helps us to stand up from our comfort zone and to go to people to help other people. And I think that in this particular case, why we value so much the relationship with the World Council of Churches and other faith-based actors involved in AIDS response, because you are demonstrating by activities, by projects like this one, like these tools, that you are catching up, that you are with us in following the developments, in learning the latest, in addressing the recent challenges, but at the same time in innovating the response, in giving like a significant, very often innovative input to the implementation of our global guidance. So what we have under discussion today, we have 2 documents that are, in one of them, in a sense, is a great guidance to our faith partners and beyond on what they should do and how they should do in order to address key challenges of the AIDS response of today's reality. And this is very much evidence-based and very much client-oriented tool that will help us to meet the objectives, global objectives of the strategy as well as of the political declaration. And on the other hand, we have another tool that is a set of, like I would risk to say, best practices of what countries are already doing in order to achieve these objectives. So I will not continue more because I think we all need to hear from Dr. David. But again, this kind of approach is demonstrating that our faith partners in HIV response are not awaiting some developments from others, but they are proactively going into the implementation by unleashing their best powers and resources to make sure that they do their part within the AIDS response. For this reason, UNAIDS will always cherish you and embrace whatever you are doing for our patients and clients. Thank you very much.
Thank you so much, dear Jacek. He was present today in the prayer in the World Council of Churches in the morning, along with more than 10 colleagues from UNAIDS, which shows the partnership. Also to all the people who are present. This day is very busy for people living with HIV. There are many, many events happening. So I know many are doing similar things, and then we appreciate the ones who were able to make some time to be here. So we are going to continue with the presentation of the documents. This is going to be presented by Dr. David Barstow. He is a computer scientist by training and profession, earning a PhD in artificial intelligence from Stanford University in 1978. In 2006, he felt a calling to help with the faith response to HIV and AIDS. For many years, he worked with local churches in Southern Africa to help them deal with the stigma associated with HIV. More recently, he has been active in several global organizations, including UNAIDS, and he became now a commissioner in the Health Commission of the World Council of Churches. Dr. Barstow lives in Corvallis, Oregon, on the west coast of the United States, where he is an elder at First Presbyterian Church of Corvallis. So thank you so much, Dr. David Barstow. We'll listen to you.
Well, thank you very much for the introduction, and I really appreciate the opportunity we've all had to work together to create these documents, and I appreciate all the kind words, Jacek, that you and Manoj. Thank you. I'm going to share the screen now. I hope this works. Can you all see that all right? I trust?
Yes.
Well, we're missing the first slide, but that's okay. We'll go from here. Yeah, let me just start with some background. As you know, the WCC has been heavily involved in the faith response to HIV for many decades. And especially in the last two, there have been two organizations within the WCC that have played a central role. One is EHIA, the Ecumenical HIV AIDS Initiative and Advocacy, and the other is EAA, the Ecumenical Advocacy Alliance. And as Gracia mentioned, a new commission has been created within the WCC, the Commission of the Churches on Health and Healing, which will be the coordinator for future HIV work of the WCC. And in preparation for this transition, the combined leadership of EHIA and EAA met in Kenya last year. And at that meeting, there was a request for the WCC staff to prepare a description of the best way that the WCC and the faith sector generally could support the global AIDS strategy. So this document is the response to that request. As source documents, we use the 5-year strategy adopted by UNAIDS in 2021, the 5-year strategy released by PEPFAR in 2022, and the 5-year strategy adopted by the Global Fund in 2011. And I should note that UNAIDS has recently published a strategic update called The Path That Ends AIDS, which provides similar strategic guidance, emphasizing that we know what to do. The challenge is to make sure that we do it. Although the source documents were organized differently and described different strategic approaches, they are broadly consistent. And this is, of course, not surprising, since the three organizations have been close partners for 2 decades. And on reviewing the strategies, we found 3 main areas in which faith sector actors are especially important to the global AIDS response. First, integration of faith communities into the public health system, and this is both at the national and the local levels. Second, reduction of stigma, discrimination and inequalities in HIV services and outcomes. And third, reliance on data and evidence to guide HIV programs and interventions. So in a sense, what this list is saying is this is what the faith sector needs to do if we are to end HIV and AIDS public health threats by 2030. Now, many faith actors have made contributions along these lines for a long time. The challenge is to scale up. So that was a list of what we need the faith sector to do, but the faith sector isn't a single entity. It's a collection of diverse actors from diverse religious and cultural traditions. So it's impossible to classify them all, but here's a rough list that we worked with to help do the analysis. Local faith communities. These are the places where people of faith regularly gather to practice their faith. National and international faith communities are the organizational structures of which local faith communities are a part. National and international interfaith coalitions, such as the WCC. Faith-based hospitals and clinics that directly provide HIV services. Faith-based relief and development organizations, NGOs, that are often international in scope. And finally, prominent religious leaders who, for whatever reason, have significant national or international influence. Now, in listing these faith actors, I want to emphasize the special importance of local faith communities. And the theme of this year's World AIDS Day, as I think Manoj mentioned already, is let communities lead. And local faith communities are the part of the faith sector that have that leadership role to play. So if these are the actors, what should they do? They all have different strengths and opportunities, which can be applied in a variety of ways, but which we can summarize as generally concerned with advocacy, implementation of best practices, and capacity building. Now, these are all elaborated in detail in the document, including specific recommendations for each of the faith sector actors. But we don't have time today to go into all those details. Instead, we'll talk about one more piece of the global AIDS strategy, namely the establishment of quantitative targets. This chart shows the targets for 2025 that are identified in the UNAIDS Global AIDS Strategy. As you can see, they are considered ambitious, but their achievement is also necessary if we want to eliminate HIV and AIDS as public health threats by 2030. Now, what would it mean to have quantitative targets for faith contributions to the global AIDS response? There isn't a single organization or entity that can establish targets for the entire faith sector, but there are many faith sector actors who could sensibly set their own targets, such as the WCC. And there are interfaith coalitions that could help coordinate to ensure that they are implemented consistently. So here are 3 targets that we would suggest. People who actively participate in faith communities meet or exceed the HIV epidemiological targets for the general population. This, frankly, seems pretty obvious. We don't want members of local faith communities to pay a health penalty just because they're members of the faith community. Second, in regions of high HIV prevalence, more than half of the local faith communities have adopted stigma reduction practices. Now, in fact, we don't know whether half is the right number. The important thing is that there are enough local faith communities that are doing stigma reduction that it influences the whole of society beyond the borders of just those faith communities. And finally, all faith-based HIV prevention and treatment centers provide services grounded in scientific evidence and reflective of good practices without stigma, discrimination, or risk of criminal prosecution. And here, all, frankly, seems like a very high bar to achieve, but like UNAIDS, we need to set ambitious targets. Now, these are just suggestions. To be fully usable, each needs to be articulated in more detail. We will need mechanisms for measuring them and for tracking progress. And so we would strongly encourage major interfaith coalitions like the WCC to develop such mechanisms. So what do we suggest as next steps, given this analysis? Here are three near-term initiatives. First, integrating national interfaith coalitions into the planning, implementation, and monitoring of more national HIV programs. There are many good examples of this kind of integration, but we need many more. Second, articulation of HIV good practices, especially for local faith communities and for faith-based hospitals and clinics. These are the two actors in the faith sector that work most closely with individuals and clients. And that's why it's important to articulate the best practices for them to take. And third, development of a monitoring and evaluation framework for faith-based HIV initiatives. And this would enable us to do what we just talked about, namely set targets and measure progress toward achieving them. So that's the first document. The second of these two steps is the focus of the second tool that we're launching today. So as we saw in the strategic analysis and in line with the World AIDS Day theme of let communities lead, local faith communities play a central role in the faith response to HIV, especially in reducing stigma. Of all the faith actors, local faith communities are perhaps the most important because they have the closest contact with and influence over their members. Given this importance, we undertook a two-part study to identify and articulate those things that local faith communities could do to reduce stigma. We prepared a guidebook for use by local faith leaders. You can think of this as an embodiment of the latest UNAIDS guidance. They said, we know what to do, you just need to do it. This list of recommended practices is based in part on a case study of 8 congregations that we conducted last year. We interviewed leaders, both ordained and lay, as well as people living with HIV, to find out what these congregations did about stigma and what the effects were. We took the results of the case study and combined them with an analysis of HIV training materials that had been done previously. Here is a list of the training materials that we used as sources. And I should note most of these are Christian sources, but not all of them. For example, we used the Muslim version of World Vision's Channels of Hope program, and several of the sources made explicit reference to non-Christian traditions. So I will say that in articulating this practice, we made an effort to be as interfaith as possible, so that we hope that this work will be useful beyond the WCC and beyond the Christian faith. The result of these studies is a list of 15 practices, and don't try to read them right now. This is just a list so you can see them in one place. We refer to them as recommended practices, but we do recommend them. Jacek mentioned the idea of best practices. We don't think we're quite there yet. We certainly recommend them, but it will take a little more research to be sure if they really are best practices. There's not enough time to go in depth in each of them right now. That was the purpose of the guidebook. Today, let me just go over the list very briefly. First, Talk openly about HIV and AIDS, consistently and repeatedly, giving messages of compassion and hope rather than judgment, rejection, and shame. The phrase break the silence has been a rallying cry since the beginning of the epidemic, and it still is. 2, motivate the HIV response by explicitly referring to sacred values and sacred texts. In our case study, the congregations often referred to the Great Commandment about loving our neighbors as ourselves, and to Matthew 25, where Jesus says that when we serve the least of these, we are serving him. Other religious traditions have similar references. Number 3, provide accurate information about HIV and AIDS and correct myths and rumors. Our churches, and in fact all faith communities, should be sources of correct information and not information, truth, as Manoj pointed out early in this webinar. Number 4, always speak about HIV infection as a medical condition, not a punishment for immoral behavior. HIV is an infection by a virus, nothing more and nothing less. Number 5, engage meaningfully with people living with HIV and with key and vulnerable populations in the wider community. Now, meaningful engagement means to work with, including in the planning and operation of HIV programs. Number 6, be careful to use inclusive and non-judgmental language. The words we use often carry meanings and implications that we don't intend. Number 7, encourage all members to know their HIV status and, if HIV positive, to seek medical treatment. Knowing your status is the first step in dealing with HIV. Following medical protocols is the second, ultimately leading to viral suppression and a full life. Number 8, develop a holistic accompaniment program for members living with HIV, including physical, psychological, social, and spiritual dimensions. Accompaniment was a common theme in our case studies, and holistic programs were also a common theme. 9, provide comprehensive information and guidance about methods for preventing HIV transmission. Talk about transmission, about prevention can be difficult because we fear that we will encourage behavior that we might consider immoral. But the solution isn't to withhold information. The solution is to empower people with correct and complete information. 10, offer HIV services to the wider community, especially to key and vulnerable populations. This is important, but again, it can be challenging for many faith communities, and so it may actually take a long time to fully accomplish. 11, educate and empower young people to navigate life challenges. Many people fear a youth surge in new infections. Education empowerment will prevent it. 12, openly discuss HIV stigma and the ways that religion can both help and hurt. Fully addressing stigma requires that we acknowledge the stigmatizing effect that some faith communities and some religious leaders have had. 13, acknowledge and openly discuss topics related to HIV that may be challenging or controversial. There are many other topics in addition to stigma that faith communities can and should address. For example, gender-based violence. 14, work closely with other community organizations. We all know that we can all be much more effective if we work together. And finally, 15, advocate strongly and publicly for universal access to HIV prevention, testing, and treatment services for all who need them. Advocacy by faith leaders and communities has been important in the past, and it will continue to be important for a long time. So now that we have the guidebook, what should be done next? First, adapt the practices to a variety of cultural and religious traditions. Although these practices are in some ways very specific, they're also somewhat generic and may require adaptation for use in different contexts. Second, build the capacity of local religious leaders to implement the practices within their faith communities. This is an example of the capacity building that was described earlier in the strategy document. Third, conduct research about the effectiveness of these practices. Can we develop evidence that these recommended practices are actually best practices? And finally, develop a monitoring and evaluation program based on these practices. This goes back again to the third area of emphasis for faith sector contributions in the strategy document. So thank you all for your time listening to this, and thank you again to UNAIDS and the WCC for undertaking the publication of these two documents. And now back to you, Gracia.
Thank you so much, Dr. David. I read the document many times, but every time I review it, I get something new. Like now I was writing, we need to do this research also to say that the recommendations, to prove the recommendations are really effective. I think we know they are, but we don't have that in a document. So I am continuously learning from the tools already, although I know them very well. Now, to the participants, do you have any questions that you want to ask Dr. David about the two documents, or comments related to the topics? I open up for your questions and comments. I wonder if Lynn Van Rooyen wants to say something, since she's been involved also in the publication of the documents. I'm not sure she can talk since she might be traveling, but oh, there she is. Like to hear from you, Lynn.
Hi, Gracia. It seems I'm frozen, but I'm here.
Okay.
Yes, I've been involved in this material with two different hats on, with my WCC publication hat, but also with my interfaith health platform hat, and working on this material from a copy editing point of view. And I really want to celebrate the two different focus areas that we have in this material. From the one perspective, the strategic, the long-term, how faith communities fit into the wider response of international organizations. We're not something separate from the world movement around HIV. We are integrated, and the way that we have highlighted this in the strategy document shows that. But then there's the other part of it, which is very practical, very real, on different levels within communities. And I think that is probably the biggest role of faith communities, is how we can address stigma. In the early years, when I started becoming involved, and many of you were involved in HIV, the faith community was always bashed. We were the ones that were adding to stigma in the public voice. But I think that we've really done a lot in the last 35 and longer years to address that. And this resource gives us practical, down-to-earth, simple ways in which we can continue to do so, and do so even more intentionally. And that is what I want to celebrate. I also want to celebrate the fact that these publications are available for free download. So I will put the links in the chat, but this is not something anyone has buy. It's something that anyone can access freely. And we know that UNAIDS have been emphatic about the role of communities, and faith communities are in so many places where we have high incidence and still fail in so many ways. We are in the heart of all communities. We were there before HIV. We will be there after HIV. And we are communities. We are communities at heart. We are communities in spirit. And I would like to encourage people to use this material and to continue to do the work they are already doing. Thanks, Gracia.
Thank you so much, Lynn. I'm still calling any people who want to give an opinion or remark. What Lynn said is very important. We have moved. Yes, it is true the faith communities contributed to the stigmatization, but we have moved, we have grown, and we are working with the people living with HIV in many places now. I think this is important that we acknowledge.
I want to, I guess I reiterate, you know, Yasi will appreciate this, the importance of monitoring and evaluation. He and I have been working for, I don't know, is it 2 years maybe, to try to get a monitoring and evaluation program. And it's my hope that the list of practices can be a foundation for an M&E program for faith communities. So you can imagine having training programs, and the training programs talk about how many leaders are trained, and then they provide tools that the faith communities themselves can use to say, okay, these are the practices that we're doing now. This is the progress that we're making. So like I said, I'm hopeful that that list of practices can be a good foundation for the monitoring evaluation programs that, like I say, Yas is going to have talking about for 2 years. And let me mention that also, I want to give a shout out to Ken and Gideon for who really started us talking about monitoring evaluation at the Montreal AIDS conference. Ken and Gideon via Magisha, who is, I think, right now flying to Ikasa in Zimbabwe. He came up with the phrase statistically significant love, which I love. I think it just exactly encapsulates what our role is. If we can show that the love in our faith communities is statistically significant, that's what will break the stigma.
Okay, thank you so much. When preparing for this, I was thinking, so what's going on with the faith sector? Why do we need to keep doing these publications? The HIV epidemic changes very fast. There is new science, there are new strategies, policy documents, and we need to be updated. Our response has to walk alongside what the World Health Organization and UNAIDS are saying, and other large partners that have experience. So the first document, the document on the strategies, is meant to provide some guidance for that. And the other document has real experiences from the churches, which I find amazing, because what we can read in that document is that they didn't have large budgets, but they had commitment, you know, and often it was one member in the church that had a relative living with HIV, a friend, and this is how the programs started. So we can all do it in our congregations. Okay, so it says HIV publications in 2024. Some of these are coming very soon. The first one, good news about HIV treatment, cure, and healing. This is a discussion on the concepts of cure, healing, and treatment according to the Christian and the Muslim faiths. This document came as a response to some faith leaders saying, don't take your medications, just pray, and God will heal you. This is an advice that is still given in some countries, and is taking people away from taking their treatments. So this will be a 7-page or maybe 8-page document. It's almost ready. It only needs some changes. It will come online I don't know if we will print on paper, but it will be ready. So this is to respond to these misleading theologies that say you will be healed only by faith and don't take your medications. So the document is saying taking your medications is also faith healing, because the science that God gave us is also a miracle from God. So this will be ready, I think, in February, March next year. Other 3 documents to be ready, 4 documents to be ready in the first trimester of next year are 4 HIV theological manuals. One is HIV among young people. This is a difficult area for the faith communities, because some people think if we give information to the young people, they will have a lot of sex, and they will become promiscuous. And in this document, we are discussing what is the pastoral responsibility, the spiritual mandate to educate our young people. And if we don't educate them, what happens? And it's bringing perspective of how young people are being exposed to the HIV epidemic. And the numbers that we receive from UNAIDS and WHO are showing us that young people are a priority to work now. The second manual is on HIV prevention. This is also another area that is a little bit difficult, because we might not agree with all the methodologies to prevent, but important that we have so many methodologies now to prevent HIV, which is important that the faith leaders, the churches, the faith communities understand what is these latest strategies for HIV prevention. And the third one is HIV and mental health. We saw that many people after the COVID pandemic remain with issues on mental health. And they are asking that we integrate this in the work of HIV or in the work of WCC. And the last one is on HIV and migration. There are many people who are moving around the world, and what happens to them if they are already living with HIV, on when they are maybe at risk, and then on the moving from one country to another, they get HIV. What is the church doing? The documents will be around 30 pages. So now we are in the process of editing them and putting them on 30 pages. And we will do trainings in some countries with these manuals next year. These countries will be more or less Nigeria, Uganda, maybe Malawi, and DRC. I don't know if we will be able to include more. I pray so, depending on the availability of funds. They will be available online as well. Another document to be ready the first trimester of next year is an analysis of HIV impact, stigma on the uptake of services among women, adolescents, and children living with HIV. This is also ready. It only needs some little revision, and it will be published online. This document has literature review, what the studies are saying, and what the women and the young people are saying, and it will combine the two knowledges and give us some recommendations of what can we do together, faith leaders and communities living with HIV unaffected, to respond to the impact of HIV stigma among women, children, and adolescents. And we have another document. This might come at the end of the year. It will be maybe called Living with HIV, Living with Disabilities, Living Our Faith. In every country that we have been this year and last year, people told us, I am living with HIV, I am living also with a disability. What can we do about this? So we saw this intersection is becoming very strong. I'm not sure why, so we are going to produce something with this. The World Council of Churches has a program that is called the Ecumenical Disability Advocates Network, and they do very good work. So we are going to work with them for this document. I'm not sure if it will be like a manual or what, but there will be something that we need to say about these intersections. And we are going to produce something small that anyone can read related to what is a safe space for people living with HIV and affected communities in the faith space. How can we make these spaces safer? We have been told by some partners that our spaces might not be always safe, and this is a reality for everyone working on HIV. So we have to ensure the spaces are safe. And there is one document that I forgot to put here, which is a collection of the strategies used in the program that Dr. David was mentioning, the ecumenical HIV and ecumenical advocacy initiatives and the Ecumenical Advocacy Alliance. These two programs are coming to an end this year, so we are going to put the best strategies of this program in a document so that we continue to work on that. These are the documents that are coming next year. We hope to keep you engaged on reading. We want you to use these tools and comment the tools. They are not the Bible, so we should use them. Okay, I think Reverend Kenneth Matata is in the room. Okay, go ahead.
Yes. Thank you very much, Gracia. I think you have already highlighted the resources that we are sharing with our communities, and I don't want to repeat the summaries you have given. What I want to highlight is the purpose of these resources, which I find helpful to repeat. First, that we want to use these resources so that we continue to share correct information about HIV. One of the biggest challenges we encountered during the beginning of HIV was sharing of different conspiracies and misinformation, which led many people to not to take seriously the advice on prevention and on treatment. So I think we need to continue providing such resources so that correct information drowns misinformation that goes out. The second, I think, important value of these resources is to build a long-lasting partnership with those living with HIV and other secular actors. Of course, we provide these texts in language that is accessible to our main constituency, who are the faith communities. But we also try to bridge the conversation between faith communities and secular actors, because our vision is the same, that people may be well, even if they may be living with HIV. The third also important reason for these resources is that we continue to provide a holistic view of HIV, so that we do not present the idea of this condition as something that is only about the virus, but also paying attention to the whole person, to the whole community. And in the faith communities, individuals and families are at the center of our congregations, and therefore we want to go beyond the focus on the medical dimension to the more relational aspects of treatment, because we think that this is also going to be helpful, not only for treatment, but also for prevention. Last but not least, we think that these resources can also help to change attitudes, create safe spaces, as Gracia was saying, and to move communities from this stigma and discrimination, and to strengthen our commitment to relationships based on love and compassion to those who are infected but also affected. As we shared today in the morning, that the theme of this year's World AIDS Day is Let Communities Lead. We think that these resources we are sharing today can contribute in a humble way to enabling the communities that are affected to lead. So we commend the resources to you and also to our own communities, and we hope that they can add value to our processes of holistic health and healing. Thank you very much, and congratulations to our colleagues who have been at the forefront of this work. Gracia, I also see Manoj and Lynn and others who have been behind the production of these resources. Thank you for your commitment. And we appreciate, of course, our partners, UNAIDS and others who continue to support the work of the church in contributing to the protection of people who are infected, but also to contributing to the broader agenda of making sure that the dignity of all people is uplifted. Thank you very much.
Thank you so much, Reverend Dr. Kenneth Matata. I'm going to read some comments in the chat. Yes, disinformation and misinformation become a tool for stigma. Yeah, it's sad. That is how it is. Truth said well. Thank you for all the resources to support us, Romela. And the first comment was by, I can't move my, but you can see it, Luisa Guibero. Thank you so much for your comments. I think if there is not other comment, we have received a briefing of the documents. We are asking you to please read them. We are asking you also to give us feedback. These documents might be good, but might have many absences also. It is difficult to put all the important topics in a short document. So we want to know how you're using the documents, how they are being helpful. It would be very good if you please contact us.
No, thank you so much. I think it is all that needs to be said has been said, and now it's up to us for you to go read it and apply it, friends, and help it as a tool as it should be.
Yeah.
Dr. Kenneth has said.
Yeah, we want to hear how you use the document, share with your networks. And thank you so much for coming to this webinar.